Hi everyone, very good evening to all of you. First of all, I welcome you to the discussion of INI-CET July 2020. Yes, very good evening to all of you. Is this video coming right? I think it's distorted a bit, right? All right, it's okay. Chalo. So basically, how was your exam? What was your feeling after coming out of the examination hall? Because I have seen a lot of questions. First of all, a big thank you to all the students who were in touch with me, and we got almost around 1000 messages for these 30 questions I could gather from pathology. I always tell you, pathology is an integral part of this INI-CET exam and would be same for the next also. But the most important part is, how do you feel after giving the exam? First of all, please don't take this discussion to be a monotonous one. Don't think that discussion would be so much hectic after a reading for so much time. Please don't feel that. एकदम cool हो जाओ, पहले एकदम बिल्कुल cool हो जाओ. Sit like this with nothing to write. Just relax, okay? And two things you should understand. Number one, you have made a mistake. कोई बात नहीं. The only thing we'll promise is I will not make this mistake again. Number one. Second, I made it correct. Very good. I'll continue doing the same thing in the times to come. So hi, first of all, very important. Yes, there's some okay silly mistakes. Seema saying, Sonam saying yes, everything was fine. Vaishnavi question was not lengthy as expected. That's very good. Thankfully, they thought about the COVID times. Everyone is so in distress, and if they would have given very tough question, everyone who have just been calling the INI-CET examination AIM cell and saying, what have you done to us? So again, I tell you guys, please relax. Do not stress at all. Okay. This discussion is not at all to make you stressed. This discussion is not at all to make you feel that you didn't make it wrong. The discussion is only and only to motivate you कि कोई बात नहीं, गलती हुई ना, अगली बार, next time I will not make the same mistake. So with this intention, are you ready to face this live to live discussion? So I have with me around 30 questions. Yes, I have a big whooping 30 plus questions of pathology. It makes me very proud to say that most of them I have taught in my classes and also discussed in the eGurukul app, and you will realize it as I have also proof for that. But most importantly, ensure that you do not get stressed at all. Okay. So how many of you are there? Please give me a small attendance, guys. कि देखो अभी कुछ पढ़ना लिखना तो है नहीं. There's no pressure at all of studying a lot. So how many of you are present? Please let me show your strength in the live chat. You are there with me or not? I again repeat, this is not at all to make you stressed. Okay? Because I know that many of you are thinking कि अरे यार आज तो एग्जाम दिया, आज क्यों डिसीजन करना है? ऐसा मत सोचो. Please understand, आज एग्जाम दिया है ना, तो आज आपको याद रहेगा कि हाँ भाई ये गलती थी and I have not made the same mistake. Okay? So are you ready? Yes? Very good. Chalo, now I can see this power. Good. Perfect. So hi everyone. Now I can see this power. ये important अच्छा होता है ना कि you are also trying to participate in the live to live lecture. Else this would have been just a recorded format and I would have just recorded one lecture and my thing would have been over. ठीक है? चलो हाँ जी प्रवीण सर good very good evening. चलो तो शुरुआत करते हैं. There is no stress at all. पहले ये मान लो. Question number 1. Question 1. So there is a proptosis in a child. ठीक है? Proptosis in a child with a desmin positive tumor. What is the most probable diagnosis? So please let me know what you have marked in this paper and I'll also explain to you. देखो. So this is how I explain to you in my user classes. This is I've given you the notes here. Again, this question came from notes only. So this all depend upon the immunohistochemistry. What is IHC, guys? IHC is just a slide in which we put a tissue and on the tissue we put an antibody. Okay. Based on the different antibodies, we get that marker or we get that tumor as a diagnosis. For example, if you put a cytokeratin, the diagnosis becomes carcinoma. If it is vimentin, it becomes sarcoma. If it is vimentin and desmin positive, it is RMS. And what is RMS? RMS is rhabdomyosarcoma. So yes, in this question, it is embryonal rhabdomyosarcoma. A few things I'll tell you here. See, rhabdomyosarcoma is of 3 types. One is embryonal, one is alveolar, one is embryonal, one is alveolar, and one is pleomorphic. Now remember, among them, the best prognosis is of embryonal, and among the embryonal, the best prognosis is of Yes, sarcoma botrytis. This botrytis tumor occurs mostly in the female GUT, and that gives this word botrytis comes from a grape-like tumor. Okay, grape-like tumor. So remember these basic facts. It can't be leukemia. Why? Because leukemia will have given a CD34 positivity. Can't be lymphoma also. Why? Because it should have been a CD45 positivity with 34 negativity, and Ewing sarcoma will have CD99 positive, S100 positive, should be positive in a Ewing sarcoma. Okay, the simple answer to this question is A. It is embryonal rhabdomyosarcoma. Okay. This question was basically based on general path only. Question number 2. Fatafat, chalo. A patient presented with ulcerative lesions on the nasopharynx, okay, nodular lesions with cavitations in the lungs and renal failure. Now see, when you look at this question, there is a nasopharyngeal nodular lesion with an ulcerative lesion, okay. So there is an ulcerative lesion in the nasopharynx. When you first see this, many of you might be tempted to go towards COVID cell, so it could have been a mucormycosis, right? But what is then telling you is they have a cavitation in the lungs. And then they also tell you there's renal failure. That means that you're getting a triad feature. The triad is of upper respiratory infection, a lower respiratory infection with a cavitation in the lung, and that is along with renal failure. Now this triad becomes shorter case of mostly it should be vaginous granulomatosis, but I will not completely assure because this can be a Church-Strauss syndrome. If the patient has a prior history of asthma, this could be a Church-Strauss syndrome. So you have to exclude. If you move ahead, you have to exclude them. So how to exclude them? You can look for the ANCA, because ANCA is positive, as you all know. ANCA is of two types, the C ANCA and the P ANCA. I told you vaginous has C ANCA positive, right? And the two types of disease also, microscopic polyangiitis and the Church-Strauss syndrome, they have what? The mnemonic I give you always in the class, it is PCM, right? मतलब PCM कैसे याद करोगे? P अंका है ना? P अंका से क्या याद करोगे? PCM मतलब Church-Strauss and microscopic polyangiitis, and the C ANCA is mostly for the vaginous granulomatosis. So this should be mainly ANCA. So why it is not culture for fungus? It could have been a culture for fungus, but for that you would not get a history of renal failure, right? You would not get a history of cavitation in lung. So it should not be culture for fungus. I'm not able to recall the third option. Many students say it was metastasis in the lungs. I'm not sure exactly. But the fourth one was MDR-TB. MDR-TB can surely show you cavitation in lungs, but they will not show you a history of renal failure. So that is how it cannot be D also. Vasculitis is there in the option. Yes, the option exactly kya tha? ANCA for diagnosing. This was a complete option. ANCA for vasculitis was a complete option that was there. Okay. Okay. The history also had chronic sinusitis. Very good. So the history was a chronic sinusitis. That is how you can help me also, so that I can get a complete notes, and I showed you that this notes will be available in my Telegram group just after this discussion. Okay, so next question chale. Okay, this is also discussed with from my side in the Gurukul app also, as well as my regular lectures. What I tell you is there is asthma history and allergic rhinitis history in a Church-Strauss syndrome. But when you look at a vaginous granulomatosis, you see a cavitation in the lung, and you get what? You get a granulomatous vasculitis. So this is a granuloma with a giant cell you see here, and along with it you can see leukocytoplastic vasculitis in a vaginous granulomatosis. Okay, chalo. Not a feature of paroxysmal nocturnal hemoglobinuria. Not a feature. Okay, one option was small SCC of the lung. I told you this one option. I tell you this was SCC of the lung. Very good. One option was a small cell cancer of the lung, SCC of lung. Very good. Thank you. Thanks a lot. Okay, चलो आगे बढ़ते हैं. Not a feature of paroxysmal nocturnal hemoglobinuria. So see, a PNH, this is also discussed in our regular classes and my notes also. I have given you a snapshot of my notes here. So I have taught you this, कि what happens because of excess complement activation is there's a triad finding. A triad क्या होता है? Pancytopenia with hypercellular bone marrow. This pancytopenia may progress to aplastic anemia. There's intravascular hemolysis causing what? Hemoglobinuria. And then there surely is thrombosis of the hepatic veins causing Budd-Chiari syndrome. But the cause of this is unknown, and therefore it is never asked. Diagnosis is often done by hamsters, as well as serum lysis test. You can also do a flow cytometry, in which you have to rule out the CD59, 59 in the surface of RBCs. And you may also get one more thing, and that one more thing is, yes, it is the sucrose lysis test, and a recent one, a flare test, a fluorescent aerosol test. So क्या होगा इसका आंसर? Please understand one thing. The answer to this question, it can be thrombosis, it can be aplastic anemia, it can be hemolysis. The answer should be A. But honestly speaking, PNH has also been shown to progress to leukemia. Okay? But obviously, if we want to choose the best possible answer, surely the best possible answer here is leukemia only. There is no doubt about it. Okay? चलो अब देखो क्वेश्चन नंबर 4. The cells or mediators involved in the early part of hypersensitivity type 1 reaction is or are. Multiple option type was the option. So when we talk about the early part of type 1 hypersensitivity reaction, what happens? I have just again taken it from the notes only. This is the eGurukul notes I have taken it. So this is basically a mast cell. The IgE binds to the mast cell with the Fc receptor of IgE, and what happens? What comes out is histamine and the PAF. So this again comes in the early part. Remember, this histamine causing vasodilation, increased permeability and bronchoconstriction, and that is what leads to respiratory distress and the edema. Ab dekho aage what happens? The phospholipase acts on the phospholipid of the mast cells to release arachidonic acid. This is a very important concept you should understand, and that goes to two pathways: the PG prostaglandin pathway and the leukotriene pathway. And remember important pathway names you should remember. Yahan par ye bhi question aa sakta hai in the upcoming NEET exam. It can come. PGD2, it's a very important pathway marker because PGD2, this is the one which causes bronchoconstriction and vasodilation along with increased vascular permeability. Here, what is important is the leukotriene markers, because leukotriene is what causes respiratory distress by causing bronchoconstriction. Acha, let's come back to the question. Acha, question kya raha hai? Early part. So in the early part, we don't find neutrophils. Ye to pakka ho gaya. We can find prostaglandins, we can find mast cells, and we can find the histamine coming from the mast cells. So obviously the answer to this question would be A, B, and C. Sir, leukotriene and prostaglandin both was in the options. So I think that was another question. I'll talk about that question again. But if the question was prostaglandin and leukotriene, suppose the question was, if the option was leukotriene, then it would be E also. A simple logical question which can be explained again by general path. So if you are assuming that general path important nahi hai, what I've discussed till now is everything general path only. Chalo, next question. Cell mediator responsible for delayed hypersensitivity reactions. Okay, ab dekho. First of all, if this is a single answer type, the best answer is A. There's no doubt about it. But if it is a multiple option type, then the answer is A, B, and C. D is not a very good answer, so not take a D. But if it is A, it can be B and C if this is a multiple option, multiple answer type. But if you want to choose one, then the best answer is A here. A here. Okay? A here. No, prostaglandin is not always second exposure. It is not about the second or first exposure. Type 1 hypersensitivity starts only with the second exposure only. Unless second exposure is not there, we do not call the type 1 hypersensitivity reactions. Okay? So if this was a single answer type, go with type A. Let's not move B and C. It was type A and the answer is A only. Okay? Chalo. Single option is type A. Single is type A. Okay? This is how I have explained to you this also in my eGurukul notes. Okay, next question. Irradiation of the blood cells prior to transfusion prevents which of the following? Acha. First of all, you should understand what is the basic logic of doing a irradiation. So in my classes, I always talk about a GVHD has three features. I've taken this from the notes only. Rash or erythroderma. I have taken this from my notes, class notes only. There's cholestatic jaundice and there's GIT causing bloody diarrhea. Okay, ab dekho. If this whole thing occurs within 100 days, it is acute GVHD. Above 100 days is chronic GVHD. But the point is, why does GVHD occur? Dhyan se suna, listen to me carefully. Hota kya hai dekho, in a GVHD, a immunocompetent T cell of the donor destroys the immunosuppressed tissue of the recipient. Okay. अब the question is how to remove the immunocompetent cell of the donor. You cannot remove by leukodepletion. समझो बात को, because leukodepletion can be 1 log, 2 log, or 3 log leukodepletion, and that will only decrease the WBC, and therefore the WBC decrease will decrease only the effect of FNHTR, but the febrile non-hemolytic transfusion reaction. If the question is on irradiation, basically what you do is This is a single line I always write in the exam. In my own notes, ये लिखा हुआ मेरे notes में. To prevent GVHD, immunosuppressed donor T cells are removed by gamma irradiation. This is a single line you should remember, and the same is also applicable to the blood cell also. So basically what happens, the best answer here is to prevent graft versus host disease. Irradiation of RBC, yes, irradiation of RBC was given, I understand. Okay, blood cell and the RBC was given, and the basic logic of doing this, was, yes, it is a, क्या है ये? The basic logic of this was to prevent graft versus host reaction. Okay. The question is, how will you prevent HLA immunization, HLA elimination? You do know how to prevent this one? This can be prevented by avoiding donation from, it can be prevented by avoiding donation from a multiple pregnant female, multiple times pregnant female, not multiple pregnancy. And the second one you can also prevent HLA elimination by doing what? By avoiding donation from multiple transfused people, multiple transfused donor. Okay, what is immunomodulation? Immunomodulation means you are decreasing the immune activity of the recipient. Okay, it's not a very logical way to remove immunomodulation. So we'll move only with option A only. Now, why not, sir, transfusion-related lung injury? No, transfusion-related lung injury, this actually refers to TRALI. And how can you prevent TRALI? The TRALI can be prevented only by doing this thing. Okay, please understand. Also remember that TRALI is seen also with FFP. So even if the option is RBC, you will not think about TRALI here. Okay? So even with multiple answers, the option will be A only. Okay? If there is any other discussion on this, please let me know. We'll discuss this at the last of this discussion. Okay. Next question, question number 7. Arrange the following cellular events of inflammation in the right sequence. Well, you all remember, I have always revised this in a simple diagram like this. This is a simple diagram I have again taken from my own notes of my Gurukul notes. देखो क्या है ये? This is a neutrophil. The first thing is happening is come to the margins and hence called as margination. ठीक है? Next thing is it rolls upon and hence is called as rolling. Third is it adheres here. Okay? तो first क्या है? Margination. Second क्या है? Rolling. Third क्या है? Adhesion. और fourth क्या है? Transmigration, also called as diapedesis. इसके बाद का step, if you remember, fifth step is chemotaxis, next is phagocytosis, and last step is killing. Okay. Now look at the options. The options are here: rolling, adhesion, cytokine mediated integrin activation, and endothelial margination. So if I explain, if I put this, पहले क्या होगा? 4, then क्या होगा? 1, then क्या होगा? It is the इंटीग्रिन से क्या होगा? एडिशन होगा. सो 3 एंड देन क्या होगा? 2. सिंपल लॉजिकल बेस्ड क्वेश्चन. सिंपल लॉजिकल बेस्ड क्वेश्चन. ठीक है? 4, 1, 3 and 2. 4, 1, 3 and 2. ओके? 4, 1, 3 and 2. चलो नेक्स्ट क्वेश्चन. द फॉलोइंग इज अ RNA based sequencing technique. So in the RNA-based sequencing technique, if you know nothing about it, also then you can mark it correct. How देखो? So I hope you have all watched the video I made for COVID-19. Because how important it is to stay connected with the faculty, because most of the things I have not discussed completely in my classes, but was discussed post classes in the video lectures. Okay? देखो कैसे? Suppose देखो, it cannot be Western blot because you all know Western blot का काम ही क्या होता है? For protein analysis. You all know this. Western blot is for protein analysis. You all know this. So it cannot be a Western blot. अच्छा, G banding is for chromosome staining. तो ये तो हो ही नहीं सकता. Now you will get confused between RT-PCR and Sanger's. RT-PCR and Sanger's. Okay, previous question में it was margination नहीं था, migration था. तो if it was migration, suppose it was migration, then that will come in the last. So then it becomes fifth migration. If the option was migration here, then it becomes a transmigration, becomes the fifth one here. So that is how I was given this question, and I hope you can understand. This is the basic idea of doing a discussion. If the option is migration, not margination, then it would be fifth number. ठीक है? चलो next question. Which of the following is a RNA based sequencing technique? अब देखो, now you are fixed between option A और option B. अब tell me what is the basic purpose of RT-PCR? बताओ मुझे RT-PCR क्या है? RT-PCR क्या है? RT-PCR is reverse transcriptase polymerase chain reaction. And Sanger क्या है? Okay, what is the purpose of this reverse transcriptase RT-PCR? The basic purpose is इसको RNA से बना देंगे हम DNA. You will make RNA से you will make a DNA. ठीक है ना? How? By putting what? A RT enzyme. RT enzyme क्या होता है? Reverse transcriptase enzyme होता है. So unless you don't do the reverse transcriptase, you cannot make the DNA from the RNA. You cannot make the DNA from the RNA. And therefore, the best answer would be A only. But what is Sanger sequencing? Sanger sequencing क्या है? In Sanger sequencing is basically a DNA based sequencing. It's a DNA based sequencing technique, which I have explained to you again in my Gurukul notes. If you look here, this is where I have explained to you the entire chromosome can be sequenced by Sanger sequencing. It's an old sequencing technique. The new sequencing technique is a NGS, next generation sequencing. This generation sequencing, what it does, it first breaks the entire chromosome into multiple parts, and then in the individual chromosomes is then amplified with the help of polymerase chain reaction, and therefore the right answer to this question should be A. प्रोटीन सीक्वेंसिंग के लिए क्या है बेटा? वेस्टर्न ब्लॉट. जी बैंडिंग किसके लिए है? क्रोमोसोम स्टेनिंग के लिए. सो राइट आंसर शुड बी ए ओनली हियर. टेलीग्राम लिंक क्या है? टेलीग्राम लिंक you may just find me in the telegram group only by just typing pathology by Dr. Praveen. आगे देखो, origin of CLL and SLL. CLL and SLL. अब देखो, the origin of CLL and SLL क्या होता है? Look at this part which I explained to you in my own notes. Again, this question came from my notes only. देखो CLL क्या है और SLL क्या है? Chronic lymphocytic leukemia and the small lymphocytic lymphoma. अच्छा, यहाँ पर the word I written here, if you all remember, is this word. देख रहे हो? Cell of origin. बिल्कुल, it has been taken from the notes. It is written in your notes also. It is a naive B cell. Now remember, if the option would be a mature B cell and naive B cell, you cannot choose a mature B cell because every lymphocyte is also a mature B cell. So you can't choose a mature B cell. So looking at this option, it can't be, देखो mature T cell तो हो ही नहीं सकता, naive B cell तो हो सकता है, mature B cell हो सकता है, and germinal center हो नहीं सकता. So right answer for this question is B only. B is the best answer to this question. Remember, a naive B cell is a cell which comes out from the bone marrow and it then enters a lymph node, and first it enters the mantle zone. Okay, it first enters the mantle zone. One option was naive B cell from germinal center, doesn't make any sense. So if the option was naive B cell in germinal center, it is not right answer. Right answer क्या होगा? Naive B cell only. Right answer will be naive B cell only. Yes, first line ही लिखता है 5000 naive B cell. चलो आगे बढ़ते हैं. This question. A 10-year-old athlete suddenly collapsed and died. ठीक है? His case was diagnosed as a sudden cardiac death. I think the examiner had recently watched this football soccer match between the in Germany, whose captain suddenly fell sick. Obviously he didn't have the HOCM, but yes, he had a small MI, what is believed to be there. Based on the autopsy image shown here. क्या autopsy image? ये देखो. And if you remember, in my telegram group, I clearly asked you one question. Explain this with the help of a fruit, and most of you had answered correctly. So this is a banana-like configuration. I hope you all remember. It's a banana-like configuration. It is seen in a HOCM. There definitely is not arrhythmia. It surely is not rheumatoid heart disease. It is sudden cardiac death due to hypertrophy at the heart chamber. The right answer is C. The right answer here is C, guys. Okay, right answer क्या है? C. Okay, it should be C. Yes, I also explained to you in integrated session, and this is how I explained to you in my own notes. The exact same image was taken from my notes and was given in today's INI-CET. Don't stress out. गलती है तो उसको सही करेंगे, और गलती नहीं है तो कोई बात नहीं. Now remember one more thing. The question can also be asked in other way. The second question which can be asked on this is, which is more hypertrophied, septum hypertrophy or the wall hypertrophy? क्या होगा आंसर? Tell me in the group. फटाफट बताओ. What is more hypertrophied? It is septum or the wall? What is more hypertrophied? Second question is, what is this histopathology called? This can again be asked in the NEET exam. They'll take this question from the INI-CET only. I can tell you, I can bet on this. This is what is called as, batao, fatafat. Yes, with the screening of the family, definitely. This was also the option. Something connected with hypertrophy of the heart and screen the family members. Why to screen the family members? Why to screen them? Because it is autosomal dominant. It is HOCM. Remember, HOCM occurs due to the mutation only, and the mutation is a beta myosin heavy chain. The mutation occurs in the beta myosin heavy chain. Beta myosin heavy chain, very good. It's a septal thickening, and that ratio is around 4:1. Very, very good. It's septal thickening, asymmetrical septal hypertrophy with a ratio of B 4:1. Okay? So right answer is that only. Answer क्या होगा इसका? Answer is C. Remember, answer is hypertrophy of heart muscle with screening of the family members. Okay? फटाफट आगे बढ़ो. Okay. The following is used in Sydroblastic anemia. So I will be very honest. I have not taught you this. Let me be very honest. I have not taught you this. Right? But if you have read biochemistry, you could have answered this. कैसे? पढ़ो तो. What is Sydroblastic anemia? It basically is a condition of iron overload, right? तो iron overload क्यों होता है? Because if you look at the basic knowledge here, the basic problem in the Sydroblastic anemia is hemoglobin बनना है. कैसे बनना है? Iron से, from iron and with heme. ठीक है, मतलब hemoglobin, iron बनना है and heme, मतलब with this what will come is, this is very sorry, iron and porphyrin, very sorry, iron or porphyrin, sorry, iron and porphyrin. This two will become what? Will become heme, and then with this heme comes a globin part, and then it becomes what? Hemoglobin. Okay, it becomes hemoglobin. अब क्या होता है देखो, this porphyrin or the heme synthetase का जो first reaction है, it is ala synthetase. The first reaction is the ala synthetase, whose coenzyme is the coenzyme is what? It is pyridoxine. The coenzyme is pyridoxine. So coenzyme of the ala synthetase is pyridoxine. So when you give pyridoxine, what happens? The ala synthetase starts working fine. When ala synthetase works fine, then what happens? It makes more and more heme. Because it forms more and more heme, it will utilize all the iron from it, and so the iron overload will start decreasing, and that is how it will also make more and more hemoglobin, and hence curing a patient. Okay? So right answer to this question is yes, it is B6. It is pyridoxine. B12 was also the option. Thank you very much. B12 was also the option here, but the right answer is B6. आगे बढ़े. Fixative used in pap smear. Well, this is the video I made, and I told you never to ignore the video that I put. Okay? This is the video I had put in some days. Even this is a simple question also. You don't need to watch the video also. It is 95% ethanol. Remember the fixatives. The most common fixative used in tissue biopsy is 10% formalin, and for GI biopsy and for sperm morphology, what you use is a Boyne's fluid. But if it is in pap smear, what we use is 95% ethanol. I explained to you in my video also. Look at this clearly. Solution of ether with 95% ethanol. Okay? Solution of ether with 95% ethanol is not preferred. What we preferred is a simple 95% ethanol. A simple 95% ethanol is now preferred because ether is volatile. It can burn. It can completely destroy the lab. So we don't use that. In fact, if you notice this image, it was also the image that came in today's INI-CET. So we use gloves, we use a spatula, we use a speculum, and a few slides later I showed you a Cochlin jar. All of them are used in the pap smear. Was one more question. I don't know why, but today the examiners were quite fond of the pap smear. They gave you 3 questions on the pap smear. Yes, my image is also there. Thank you. Chalo. The instruments used in pap smear was a multiple option type. So we use air spatula. You can use a cyto brush. We can use a retractor, and we have to use a fixative. So for this, the answer should be all A, B, C, and D. It should be A, B, C, and D. All of them should be there. All of them should be there. So image, I didn't get a brush images, but I could see this one, and I think it was quite an easy one. सो यस, 3 क्वेश्चंस एक्चुअली. द पहला क्वेश्चन आया क्या, फिक्सेटिव्स के ऊपर. सेकंड क्वेश्चन क्या आया, इट वाज ऑन द instruments used, and the third question was on the sequencing of the pap smear. 3 questions came in the pap smear. I'll show you the third question in the next few slides. Okay. Okay. ये आ गया. चलो, क्वेश्चन 14, arrange the steps of pap smear in the correct sequence. ऑर्डर भी पूछा था, आ गया ना, ऑर्डर आ गया. अरे माय स्टूडेंट्स टुडे हैव रियली वर्कड अ लॉट. आई रियली सैल्यूट माय स्टूडेंट्स हु एक्चुअली मैसेज्ड मी from the day, the time the exam was over, and really they helped me so much in my Telegram group. I'm really thankful to them, because only because of them I could make this question. I didn't appear for this exam. In fact, I was out for my work. So that is how you can help a faculty while a faculty helps you. It's complete give and take policy. ठीक है? Retract the vagina, take a smear, make a smear slide, and then do the fixation. Answer is A, B, C, D. Very good. A, then B, and then C, and then D was the right answer to this question. A, B, C, and D. ठीक है? Retract vagina, take the smear, put the smear on the slide, and then do the fixation by 95% ethanol. 3 questions came on the pap smear. तो क्या करना है नीट के लिए, पैप स्मीयर का वीडियो जो मैंने बनाया था उसको देखना है. यू हैव टू वॉच द पैप स्मीयर वीडियो. ठीक है? फर्स्ट क्वेश्चन क्या था, इट वाज ऑन द फिक्सेटिव्स. सेकंड क्वेश्चन क्या था, ऑन द इंस्ट्रूमेंट्स. एंड थर्ड क्वेश्चन क्या था, इन द पैप स्मीयर. चलो, नेक्स्ट क्वेश्चन. नाउ बेटा, दिस क्वेश्चन वाज अ बिट कंफ्यूजिंग, so I'll just let you know what was the exact question here. Some students had sent me the exact, they had drawn it for me. देखो, the question that was given to me was something like this. They had drawn in my Telegram group. I got this question. This is the endothelium, beta. This is the endothelium, right? Now, and on the endothelium, this marked as tissue factor. यहाँ पर लिखा हुआ था A. Okay, this was tissue factor, TF. Okay, and then it was marked here A ऐसे, यहाँ पर A और यहाँ पर भी A. And then it was shown that this A is converting factor 9 to 9A. ठीक है? And then this 10 is also being converted to 10A. ठीक है? This was the question. Now it was asked to you, what is this A? I don't know why have you made this mistake. Some of my students have made the mistake, and what they have marked here is, they have marked here factor 8. But understand one factor. अगर क्वेश्चन में यहां पर टिश्यू फैक्टर दिया हुआ है, तो why are you at all marking 8? समझो ना बात को. Please understand one point. क्वेश्चन क्या दे रहा है? In an endothelial injury, a tissue factor is released. This tissue factor combines with which of the following and then activates 9 and 10. It cannot be 8. अब देखो 8 कहां आता है? Look at this again. I've taught you everything. देखो क्या हो रहा है? Just ignore this diagram. Just ignore this diagram that has come here. But remember one thing, what happens if you look at this one. 7 convert to 7A. Now 7A converts 10 to 10A. 7A converts 10 to 10A, and then 10 converts 2 to 2A. Now understand one thing. The 8, factor 8 kahan par hai? Where is factor 8? Factor 8 will only help the 9 to activate 10. 8 will only, मैं आपको बार बताया, also explain to you in a simple way. Many times I told you कि common path को याद रखना है 10, 5, 2 and 1. I explained to you many times. अगर क्वेश्चन में टिश्यू फैक्टर दिया हुआ है, then why are you getting confused? The right answer क्या होगा इसका? It should be factor 7 only. What was the confusion? Why did you mark the factor 8? What made confused? आपको कंफ्यूज क्या किया? What confused you all was कि सर यहां पर 9 दिया हुआ है. अब सब एक सिंपल से समझो ना, हाउ डज द फैक्टर 8 वर्क्स. देखो होता क्या बेटा, फैक्टर 8 ऐसे, फैक्टर 9 यहां पर है. सॉरी, तो इसको क्लियर लिख देते हैं. द क्वेश्चन वाज फैक्टर 9 यहां पर है. ओके, 9 कन्वर्ट्स 9 है. ठीक है? अच्छा, 9 कन्वर्ट्स 10 to 10 है. विद द हेल्प ऑफ फैक्टर 8 है, ये पता है ना आपको, विद द हेल्प ऑफ फैक्टर 8 है. तो हाउ कुड 8 कन्वर्ट 9? अब you will say, sir, how did 7 convert 9? I hope you remember last time also a question came. Last time also, if you all remember, last time also a question had come, and that question was that which factor deficiency will lead to thrombosis was a question, and the answer was factor 12 deficiency. क्यों? Because देखो 12, how does 12 activate? देखो, a 12 activates 11. 11 activates 9, but remember the 7 can also activate 11, and 7 can also activate 9, and 7 can also activate 10. And therefore the purpose of 12 is not so important. This question also came in the last year's INI-CET in a twisted format. ठीक है? So the answer to this question would be, देखो यहां पर भी I put this question कि factor 7 जो है, it can convert 10 to 10A and can also convert 9 to 9A. Both of them can be done by 7A, but there's no confusion at all. If you would have seen tissue factor यहां पर, तो फिर क्वेश्चन सोचना ही नहीं था. It should have been simply, it should have been factor 7 only. ठीक है? Flow cytometry is represented by, हाँ, तो देखो, what I teach you in my regular classes is, what I teach you is, I make a diagram like this, and then what I do is, I make a x-axis and a y-axis. On this side I've done 34, and on this side 90. Okay, now these are all dots, you understand? These are all dots, right? Now, look at the other option. The flow cytometry is represented by, one is a bar chart and dots. Submit dots था, all of them have dots. ठीक है? Bar chart is not used for flow cytometry. Pie chart is also not used. So what they often use is histogram. What they often use, apart from a dot, is a histogram like this. A histogram like this. ठीक है? In this they can represent what is the amount of CD34 cells in the graph. ठीक है? So right answer is histogram and the dots. Histogram and the dots. अरे आंसर 8 नहीं होगा. It would be 7 only. इसका आंसर 8 नहीं होगा. It will be 7 only. Okay? This answer would be C. Histogram and the dots. चलते next question में. Okay. Best method to assess HbA1c level. This is not my arena, so I'll not bang my head on this. I'll come back to this question at the last. आगे बढ़ते हैं. Regarding a tumor suppressor gene, which one is a correct statement? Was a very simple question, but only if you have some time to solve this. पहला question. A BRCA1 is an oncogene, but a line is not used for the flow cytometry. The histogram is often used. Line diagram is not used. Okay. Acha. BRCA1 is an oncogene. No. What is it? It's a tumor suppressor gene. And क्या है BRCA1? It's a DNA repair gene. It's a DNA repair gene. ठीक है? EGFR positive is seen in small cell cancer. No. EGFR seen in adenocarcinoma. Adenocarcinoma of lung. ठीक है? याद है EGFR 1 बताया था मैंने. और EGFR 2 क्या होता है? वो होता है HER2/neu. HER2/neu amplification is seen in fraction of breast cancer. Very, very true statement. And remember, HER2/neu is the type 2 of the molecular classification of the breast cancer. NMYC is a tumor suppressor gene. बेटा नो, MYC जहां पर आया वो क्या हो जाएगा? वो oncogene हो जाएगा. In fact, it's a proto-oncogene which causes what? A neuroblastomas. And how do I explain to you this? This I explain to you in this big chart. I always give you in my classes that इस chart को पढ़ना है. I cannot help you a lot, and everything written here. ठीक है? NMYC लिखा हुआ है. ये पूरा chart किसका है? The chart is of the oncogene and the proto-oncogenes. EGFR was non-small cell cancer. देखो ये दिक्कत था, because initially I got the recall of small cell cancer, then becomes wrong. If the question would have been, if the second question would be EGFR positivity is seen in non-small cell cancer, then this becomes a true statement. So I am not sure what was the question. If the question was this one, then it is wrong. If the option was this one, then it is true. So you decide what was it. As I see, many of you are saying that option B was non-small cell cancer. In that case, it becomes a true. In that case, it becomes a true statement. ठीक है ना? मैं बता रहा हूं. Again सुनो. A तो false है, no doubt about it. A is false, right? 4 is also false, no doubt about it. About 2 and 3, 3 is true. 3 is true. If you look at the second one, so EGFR positive is seen in adenocarcinoma lung. That means if the option was non-small cell cancer, ये true है. But if the question was small cell cancer, ये false है. Now you tell me what is it. I understood it's multiple cell question. कोई doubt नहीं है. It is a multiple type answer. I understand that. But NMYC causes, NMYC is क्या? NMYC is a proton cause. It's not a tumor suppressor gene. So yes, 1 and 2 was correct. So you all agree? Do you all agree? It was non small cell cancer only. ठीक है, then that case it was 2 only. तो उस केस में क्या होगा? If it is non small cell cancer, in that case answer would be 2 and 3 both. पक्का? Thank you very very much. बहुत बढ़िया. हाँ, small cell cancer can be elmic, but it is not asked ना. चलो next question. हाँ, this was a superb question, very beautiful question. So let me first explain to you what they are asking. Electron microscopy, picture of alveoli with capillary, and the question was in COVID-19 disease. Which of the following is expanded? Expanded का मतलब था swollen and destroyed. I think the question was swollen and destroyed. Now what they did was they actually had marked the area A, B and C. Even though I have marked here air, but some of the students were confused कि सर अगर air नहीं लिखा है, if it's not written air, then how will we able to identify whether it is the alveolar side or endothelial side? Now remember, if such question again is repeated, the area in which you see the RBCs, suppose the area is here and you are seeing this ER मतलब erythrocyte, this ER मतलब erythrocyte, if you are seeing RBCs here, it becomes the endothelial side. In that case, what happens if you just label it? क्या होगा? This one is what? It's a endothelium. Okay, so just labeling it now. This becomes what? It becomes a endothelium. ठीक है? This becomes what? It becomes a type 1 pneumocite. It becomes a pneumocite. Which one बेटा? Type 1 pneumocite. ये क्या होगा? ये type 2 pneumocite होगा. Type 2 pneumocite होगा. Okay. Now in COVID-19, which is inflamed and not swollen? Question क्या था? Inflamed and destroyed. Very good. Thank you. Inflamed and destroyed. क्या होगा answer? It would be what? The endothelium. It would be the endothelium. Picture was not so clear. इतना clear नहीं था because again I didn't get the exact question. But yes, this is what was explained to me. So the right answer would be endothelium in this case. ये होगा इसका right answer. So if the marking was supposedly, ये मान लो A mark था, okay, this supposedly was marked B, okay, and suppose the basal membrane was marked C, in that case also the right answer would be B मतलब endothelium. It would be B मतलब endothelium. हाँ, I understand picture is not the same, picture is not very clear, I understand that, but please if you get the right picture, please send to me on my Telegram group. I will be very very thankful to you. Okay, if you get the right image, please send to me on a Telegram group. I can incorporate that also. ठीक है, ठीक है, मैं मान लिया ना क्वेश्चन डिफरेंट था, but the idea was same only. Idea क्या था? They wanted to know whether you are able to identify the endothelium or not. So अगर same question again comes later on, तो how will you identify? I'm telling you, in the area जहां पर RBC रहेगा, that is the endothelial side, okay, and that will have endothelium. Then comes basal membrane, then comes what? There comes a type 1 pneumocystis. So in this COVID-19, the main problem occurs in endothelial damage, and that is the reason they start having ARDS-like finding. The reason they have microclots, and the reason they have raised D dimer levels. सब कुछ explain to you. Concept clear है ना? This diagram is easy. I am sorry, Akhila, but I didn't get the right option, right image. इसलिए तो बोलता हूँ, please join my group and tell me the right image also. चलो, anyway, you got the right idea. पता समझ में आ गया ना? अच्छा. The most typical manifestation of juvenile dermatomyositis. This is the image I have explained to you in my Gurukul notes. 3 images I have given to you in my Gurukul notes. One is heliotropic rash around the eyes. One is Gottron papules in the knuckles. And one is this perifascial atrophy of the muscle fiber and inflammation. Right answer to this question is what? It should be the Gottron's papule. Okay, simple question and no discussion further. Look at this one. A soft tissue mass excites from the patient presenting with the sensory neural hearing loss and tinnitus. Biopsy was taken, and I can tell you, whenever I teach this topic, I tell you one thing. Most favorite question of the INI-CET or the previous aims. Without this, they don't make a question paper. They have asked you everything. They have marked Antony A areas, they have marked Antony B areas, they have marked Vertebra bodies. So everything they have asked, and they'll keep on asking till the time that every person don't make it correct. Remember, the most common originating nerve is factor 8, more than factor 10. Antony A, Antony B are the 2 areas, and in the Antony area, there's a Vertebra bodies also. Right answer is क्या? Right answer is schwannoma. इसके बिना तो क्वेश्चन ही नहीं बनता है. Schwannoma. is the right answer. Schwannoma is the right answer. बहुत बढ़िया. ठीक है. Next question. A child presented with a polyp came as shown below. This is the histopathology of the polyp. Yes, a tree-like pattern. कितना सुंदर पेड़ है. पेड़ को काटो मत, बढ़ाओ. क्या है ये? This is the muscle. देखो, the muscle is going inside, right? And along with this, you are seeing glands. This is a one branch of a tree, second branch of a tree, third branch of a tree, fourth branch, fifth branch, sixth branch of a tree. This beautiful tree is called as Hanji, arborizing pattern. Perfectly identified by many of you. It is arborizing. It is arborizing pattern. It is arborizing pattern. Okay, and because it is arborizing pattern, I explained to you again in my notes, and how do I tell you the ossify of the colorectal polyps? This my notes. I tell you HHI याद करना है. Hematomatous, Heblastic, inflammatory. In malignant, it is adenomatous polyp. Hematomatous polyp is of two types. One is a juvenile polyp. One is a Piyush-Jaghar polyp. Piyush-Jaghar polyp. अब देखो. Now the Piyush-Jaghar polyp is this arborizing pattern. Arborizing pattern. Remember the other findings that can be asked here. The mutation is SMAD4 in juvenile polyp, STK11 in the Piyush-Jaghar polyp. Okay, this is the other question that can also be asked. So the right answer is hematomatous. Even if the option was juvenile, you cannot take the answer as juvenile. Right answer is A only. If the last option was, agar last answer option was juvenile, then also that cannot be taken as right answer. It should be hematomatous only. ठीक है? So agar if you're saying yes, there was history of interception also. Yes, very correctly said. Interception. The history of interception was also there, and which proves that it is a case of what? Piyush-Jaghar polyp. PEUTZ, Piyush-Jaghar polyp presents with the same finding. Piyush-Jaghar polyp. ठीक है? It's a type of hematomatous polyp. 17 साल का बच्चा था, चलो चाइल्ड नहीं था, 17 ईयर्स का बच्चा था. थैंक यू अगेन फॉर दिस करेक्शन. वेरी थैंक यू. जुवेनाइल पॉलिपोसिस कोलाई भी था. चलो, जुवेनाइल पॉलिपोसिस कोलाई वाज द लास्ट ऑप्शन. थैंक यू वेरी मच. 15 साल था, कुछ भी. Some saying 15 years, some saying 18 years, 17 years. ओके, चलो कोई बात नहीं. कोई स्ट्रेस नहीं. टुडे विल नॉट टेक एनी स्ट्रेस. आज एग्जाम दिए हो, दिस ओनली शुड बी अ स्ट्रेस बस्टर टू यू. स्ट्रेस बस्टर होना चाहिए. दिस होल क्लास शुड बी लाइक अ स्ट्रेस बस्टर टू यू. दिस होल क्लास शुड बी स्ट्रेस बस्टर टू यू. ओके, एकदम रिलैक्स करो. अरे एग्जाम दे के आए हो ना, जस्ट रिलैक्स, थोड़ा रिलैक्स तो करो. कितना पढ़ाई करोगे? दिस शुड बी कंप्लीटली अ स्ट्रेस बस्टर. गलती हुई ना, रिपीट नहीं करेंगे. Will not repeat this. That is the biggest thing you can just promise yourself. I made a mistake today. I will not repeat it again. बस आगे बढ़ जाओ. I'm telling you, even if you get 70% marks or say 60% marks in today's INI-CET, लिख के ले लो, record me. You will be one of the Amsonians or a PGI Institute PG student, or would be a JIPMER PG student. लिख के ले लो. Even if you get 65 और 70% मार्क्स, 70% तो टॉप पे पहुंच जाओगे. यू विल बी देयर. चलो, सो क्रियाट कितना था? थैंक यू, यू आर वेरी हेल्पफुल गाइस. क्रियाट वाज ओके. एग्जाम वाज इजी. अभी पता चलेगा, रुको तुम लोग को. एग्जाम वाज इजी. हेमोग्लोबिन 7 था. ओके, हेमोग्लोबिन वाज नॉट 13, इट वाज 7 ग्राम परसेंटेज. थैंक यू. And creat was 2.3. Creat was 2.3. Okay, thoracic vertebra fracture भी था. Thank you. There was a thoracic vertebra fracture was there also in the history. Thank you. Hemoglobin was 7. Okay. Now the total protein was baba. इतना याद है? You're great. Where were you? Total protein was 13 and the albumin levels was 2.8. Wow, super. Bone X-ray had lytic lesions. Sorry, everything was given then. Then there is no reason of any discussion. It will be multiple myeloma only. Constipation was included. Okay, constipation भी था. अच्छा. The constipation can be due to hypercalcemia, right? This can be due to hypercalcemia. और क्या था? चलो अब पढ़ो क्वेश्चन. पढ़ने तो दो क्वेश्चन. A 60-year-old male presented with a low backache. Investigations revealed a hemoglobin of 7 gram percentage. Sorry for my mistake. 13 नहीं था. Calcium was 13 milligram percentage. Yes. Total protein was 13. Albumin was 2.8. Constipation was there, and this patient has a thoracic vertebral fracture. Thoracic vertebral fracture was also there. हाँ जी, तो सब कुछ मिल ही गया. This is how I explained to you in my regular classes. So those who have done my class will understand. I always tell you the finding of crab. Crab क्या है? Hypercalcemia. Okay, crab क्या है? Hypercalcemia. R क्या है? Renal failure. A क्या है? Anemia. और B क्या है? Bony lesions. The crab finding is a very important finding of what? Of the multiple myeloma, which is the right answer. Now you will say, sir, why not milk alkali? Milk alkali can have hypercalcemia, but will not have the other fracture findings and will not also have anemia. Mets will also not have the finding. They will have lytic lesions, but will not have the other findings. Hyperparathyroidism will have hypercalcemia, but will not have the other findings like this. ठीक है? चलो. The effect of GSPD deficiency is R. Before I tell you this, please read my notes. इसको तो मैं I explain to you in a simplest way. GSPD में what I tell you is actin recessive more than autosomal recessive. GSPD glucose 6-phosphate converts to glucose 6-phosphogluconolactone, and that is how NADP converts to NADPH. NADPH will reduce the GSHG to GSH. The function of GSH is to reduce H2O2 to H2NO2, right? अब अगर किसी पर्सन को ये नहीं है तो H2O2 बढ़ जाएगा. क्यों बढ़ेगा? NADPH will decrease, GSH will decrease, H2O2 will increase, or that is all. I write it here separately also. So this was an easy question. So क्या है ये? Decrease NADPH? हाँ जी, true. Decrease glutathione? No. Decrease reduced glutathione? Yes, true. Decrease lipid peroxidation? No. There is increase in lipid peroxidation. There is not decrease, there is increase in lipid peroxidation. Why? Due to H2O2 increasing. And decrease RBC membrane damage? No. There is increase RBC membrane damage. So if I have recalled the question right, then the answer is 1 and 2. If I have recalled the answer correctly, it should be 1 and 2. Okay? If the questions are answered and saved and you have not marked for review, it is counted as answered. Hanji, it is counted as answered. चलो next question. आगे बढ़ते हैं. About RNAi. So this is a simple repeat question from the previous aims. What is RNAi? RNAi is RNA interference. RNA interference, ये है RNAi. इसी को कहते हैं siRNA. It is synthetically induced RNA. What is the function of RNAi बेटा? RNAi का काम क्या है? It will inhibit the gene function by two ways. It will either stop translation, will decrease the protein translation of the gene. It will act on a gene. कोई भी gene पे it acts on a gene, and on the gene decrease protein translation, or will stop the mRNA transcription. Will decrease the mRNA transcription, and therefore the right answer to this question would be knockdown. Now you would say कि sir, what is knockdown technology? Knockdown technology ये कहता है कि suppose ये जीन है, okay, ये जीन है और मान लो कि ये RNAi है, तो RNAi will not delete the gene. The gene is still there, but this gene can be decrease the function with the help of a RNAi. It has been used to cure some cancers, like for example, अगर you see a c-MYC mutation. अब c-MYC एक oncogene है and the c-MYC is causing a Burkitt lymphoma. If you make a RNAi against a c-MYC, तो क्या होगा? The c-MYC will get decreased, knocked down हो जाएगा. तो knockdown is technology used to cure some cancers and some diseases जहां पर the problem is a overactivation of the gene function. Answer is knockdown. ठीक है, नॉक डाउन ये सिंपल रिपीट क्वेश्चन है, इट्स अ ओल्ड एम्स रिपीट, नॉट इवन ओल्ड, 3 years और 4 years बैक एम्स रिपीट क्वेश्चन, ठीक है। चलो नेक्स्ट क्वेश्चन, immune checkpoint inhibitors nivolumab. So those who have watched this video I made few days back in my YouTube lecture, you would remember this. Immune checkpoint inhibitors is nivolumab, which is a PD1, and the PD-L1 inhibitors are adalimumab and avelumab. ठीक है, this was a simple thing that you should be written there. Second, अब ये देखो यहां पर immune checkpoint inhibitors is used in, right answer इसका क्या होगा? I don't know whether it's multiple option or not, but it could be Hodgkin's lymphoma as the one of the possible answer. If it is melanoma also, it will be melanoma also. If it is retinoblastoma, it is multiple option, it can be retinoblastoma also. ठीक है, but if you want to choose one of them, it should be, best answer would be Hodgkin's lymphoma. If you want to choose the best answer, it would be Hodgkin's lymphoma. ठीक है, yes, I will just share this whole PDF after the completion of this class in my Telegram group. Please, you can take it from there. The following are events within the minutes of inflammation. So this was one question. One question was on type 1 hypersensitive reactions and one question was on minutes of inflammation. So minutes of inflammation में क्या क्या निकलेगा? Histamine is the first thing. Okay, neutrophil starts getting activated. Yes, prostaglandins and leukotrienes all start getting activated. The moment histamine comes, mast cell activation also occurs. So if I have recalled this correctly, some students say, so there are not two questions, only one question. That is, I'm not exactly sure, but if these are the options, they all will be the same. Chalo. HPV produces a protein which suppresses RB gene. What is it? I have always explained to you in a simple way. This is how I explained to you in my own notes in the female GUT system in Gurukul app. What I told you is simple याद करना है, E6 और E7, एक है P, एक है R. E6 inhibits P, E7 inhibits R. तो P53 और RB gene confusion नहीं करना है. How I tell you? देखो, 6 comes before 7, P comes before R. तो 6 will inhibit P and 7 will inhibit R. क्वेश्चन था आरबी जीन, तो क्या होगा आंसर? E7. एंड ऑफ द स्टोरी, नो डिस्कशन एट ऑल, नो डिस्कशन एट ऑल. ठीक है, एंड द स्टोरी, नो डिस्कशन एट ऑल. Okay, can someone please share my Telegram group link here in the chat? It will really help some of the students. Okay, let's try to do that. ठीक है, अच्छा, नेक्स्ट क्वेश्चन. In reference to the histopathology given below, the most probable diagnosis. So, you know, last year I took a class on dermatopathology, and thank you for really appreciating it. I explained to you in this manner. मैंने तो अपने क्लास का नोट्स ही उठा लिया. देखो, the question was on this exact image came, and what you're seeing is there is a disruption of the epithelial cell. क्या हो रहा है? देखो, दिस होल थिंग इज एपिडर्मिस, दिस होल थिंग इज एपिडर्मिस. ठीक है, अब देखो, दिस इज द स्ट्रैटम बेसेल, स्ट्रैटम बेसेल, ये स्ट्रैटम बेसेल है. ओके, अब देखो, दिस इज द अदर लेयर्स. तो व्हाट यू कैन से इज द स्ट्रैटम कॉर्नियम, ग्रैनुलोसम, स्पाइनोसम, lucidum, they all are separating from the stratum basale. This is often what you see in the pemphigus vulgaris. Right answer क्या होगा? A. It should be pemphigus vulgaris. It should be pemphigus vulgaris. ठीक है? Pemphigus vulgaris is right answer. And this how you should remember. You can also remember other things also. देखो, pemphigus vulgaris ये यहाँ क्या होता है? This is something called as row of tombstone appearance. Why? Because the antibody forms against the same thing. Now remember, if the question is bullous pemphigoid, तब क्या होगा? The basal will also separate. समझो बात को. अगर separation, क्वेश्चन तो ये इजी था, यहां पर ऑप्शन था नहीं. Pemphigus vulgaris foliaceus तो ऑप्शन ही नहीं था. It becomes simple. If the question would be that, then how to solve it? पहले देखो, अगर क्वेश्चन में पेम्फिगस फोलेशियस और वल्गैरिस, फोलेशियस क्या होता है? इट इज नॉट सुप्राबेसल, इट इज अ सुपरफिशियल स्प्लिट. पेम्फिगस वल्गैरिस इज अ सुप्राबेसल स्प्लिट. देखो यह सुप्राबेसल स्प्लिट. ठीक है. अगर क्वेश्चन में है बुलस पेम्फिगॉइड, तो एपिडर्मिस विल सेपरेट फ्रॉम डर्मिस, सब कुछ अलग हो जाएगा. ऑल द लेयर्स विल कंप्लीट टुगेदर विद द डर्मिस, ये दोनों अलग हो जाएगा. अगर क्वेश्चन आता है ऑन द बुलस पेम्फिगॉइड, बुलस पेम्फिगॉइड, यहां क्या होगा? बुलस पेम्फिगॉइड इज सब एपिडर्मल बुल्ला, और ये क्या है? सुप्राबेसल बुल्ला. सब डिफरेंस देखो. अब बुलस पेम्फिगॉइड इज अ सब एपिडर्मल बुल्ला, और सुप्राबेसल स्प्लिट होता है कहां? पेम्फिगस वल्गैरिस में. एंड इफ अ पेशेंट हैज अ एंटी आईजीए फॉर्मेशन, anti-IgA formation, it also causes subepidural bulla, but in that cause the anti-IgA will cause some skin lesions, skin lesion in form of itching, and that is what is called as dermatitis herpetiformis. अब देखो, what questions can also be asked? Question can be, this pattern in the immunofluorescence is called as fishnet pattern, and fishnet pattern is seen in what? Pemphigus vulgaris, vulgaris. ठीक है. याद रखना, these all question can come in your exams, so please remember this. If you want, I can make a video again on dermapath in 10 minutes revision lecture series. ठीक है. चलो, this question, the first question I show you, the first image I show you in my regular classes in my kidney chapter, ये दिखाता हूं आपको, and I all ask you to see that. ये क्या है? Calcium oxide. This is the question that came in today's exam. This uric acid and this is triple phosphate. Triple phosphate का appearance है? It is a coffin lid appearance. Uric acid is square and some rectangular shape, and this is called as envelope shaped crystal seen in calcium oxide. This is the same question that came here, and the right answer to this question is a calcium oxalate crystal. Calcium oxalate crystal. ठीक है. अच्छा, I have never seen a AIMS question without a Klinefelter question. आज तक नहीं देखा. And how did I explain to you in my regular classes? A simple mnemonic of Klinefelter for Klinefelter. Mnemonic होता है Klinefelter for a Klinefelter. This is from my notes only. I didn't even change it. Mnemonic of Klinefelter is Klinefelter. How? देखो, look at this karyotype. क्या है बेटा ये? It is 47XXY. क्यों? 2 X है और सिंगल Y है. क्रोमोसोम कितना हो गया? 47 हो गया. And hence it is what? It is a Klinefelter syndrome. Webbed neck कहां होता है? Webbed neck is a finding of Turner syndrome. ठीक है. Polydactyly कहां होता है? Polydactyly can be seen in Down syndrome, and Klein flat occiput in Down syndrome. This is the finding you see in Klinefelter syndrome, a simple one, and this how the in simple way you can remember all the findings. Okay, Klinefelter mnemonic का mnemonic भी Klinefelter है. I told you how to remember it. बड़ा simple है. एक बार सुन लो मुझे. What happens in Klinefelter? There is a testicular atrophy, because of which testosterone decreases. Because testosterone decreasing, the secondary sexual characteristics is absent. There may be infertility. Secondary sexual characteristics is absent, and you will find what? There is gynecomastia. Because of less testosterone, the estrogen and the testosterone ratio is high, causing gynecomastia. High LH, high FSH can be there. And remember, long stature is a very, very important finding that is called as eunuch-like body proportions. Eunuch-like body proportions. The answer should be gynecomastia with thin limbs. Turner syndrome, sorry, webbed neck often is seen in a clown's mnemonic होता है Turner syndrome का, वो भी पढ़ा है आपको. Clowns is seen in a Turner syndrome. कैसे? CLOWNS कैसे होता है उसमें? याद है ना आप लोगों को? Try to remember those mnemonic, simple mnemonic given you in the Turner syndrome as well. But it's all from my side. 30 questions I could recollect. If I will recollect more, I will add in my own Telegram group. Before that happens, so this whole thing will be shared to you in my Telegram group. Just after this, this is my Telegram group, and you may all join this. But more importantly, if you have not subscribed to the Gurukul app, please do that. I have really I really tried to do my best, and whatever has happened, don't worry. You have tried your best, and I can assure you, because it's all about trying. You have given your attempt. So if I say these questions, I'll say the questions were not very easy, at the same time were not very tough. It was something between them. Okay, so my assumption is that if you are scoring anything between 60 to 70% marks, you are in. It only depends upon whether you want to take the subject in the INI-CET counseling or not. That is all that can happen. Elsewise, I don't think anyone can stop you. Any marks of 66%, 60% to 70% is a fair good amount of time. If you're getting 80% marks, you are a ranker and a topper. I congratulate you at this point only. Please keep on working hard for the upcoming exams. Do not stop whatever rank you're getting. Please keep on working hard, and the day you get a dream rank and branch of your choice, stop and then move ahead into the next frame of your career. Okay? Thank you everyone for watching this video. I wish you all the best. Take care. God bless you all. And in case of any doubt, please you can ask me, and I will surely try to solve your doubts in that time only. And do not worry at all about this question. I tell you, this is just complete a stress buster. Just think it like you could know a few facts and some concepts, nothing more than that. Do not stress at all कि आपसे गलती 10 हो गई, 20 हो गई, 30 हो गई. Believe me, you have made 10 mistakes, your friend have made 20 mistakes, and your friend's friend have made 30 mistakes. Don't worry about it. Wait for the result, and that would be it. Okay, thank you. God bless you all. Take care. And for any feedbacks, please put in the comment box. I'll be very happy to read that. Not now, just when the video finishes. And I wish you all the best. Bye-bye.